So I know a lot of people are at home being quarantined and being safe. And so I thought this would be a good opportunity to share a little bit of my knowledge about the most common injuries and disorders that I see as an orthopedic surgeon that's an expert in foot and ankles. If you happen to hear a lot of yelling from my kids, ignore it. They are at home. I got a 6 and 4-year-old and they are tearing it up. But first today I want to talk about ankle sprains. It's the most common condition that I see in the office. There's 25,000 ankle sprains that happen every single day, one every second of the day. It's the most common injury that occurs in sports and most common injury that I see in my office. So first of all, what's an ankle sprain? Is it a broken bone? Is it a torn ligament? Is it a torn tendon? I get a lot of questions. Does it need an MRI? Does it need surgery? So hopefully I can clear that up, but I'll bring my trusty model here, and I'm a very visual person, so I'll try to explain it the best I can on the model. So an ankle sprain is actually a stretching or tearing of the ligaments on the outside part of the ankle. So there are a few ligaments that are on the outside of the ankle. See, this would be the front, this is the outside, this is the long skinny bone on the outside. So you can see here, this ligament here connects the fibula to the talus, which is the outside of the ankle. So there are actually 3 ligaments in the outside of the ankle that help stabilize it primarily. So what happens is, most common is that the ankle inverts, or we turn it like that. So you can see when that happens, you can see how that ligament can get stretched, or if it keeps on going, those ligaments can get torn. So that's what an ankle sprain is. It's really stretching or tearing of the ligaments on the outside of the ankle. So how do they happen? So usually they're injuries like this that can happen in sports, certainly, but they can happen to anybody. I could walk out of my office here and trip on one of my kids' toys and turn my ankle. I could go outside and trip on a curb, but it's associated with an injury, and most common as that ankle turns in, those ligaments stretch. So what do we do about it? Well, it sort of depends on the severity of the ankle sprain. And we usually use a classification system that has 3 grades. So a grade 1 ankle sprain would be the least severe. And what happens is these ligaments on the outside get sort of a minor stretch. And in those cases, it'll be a little bit swollen, it'll be a little tender to put weight. There might be a little bit bruising. But overall, patients, when they come to me, they're walking in the office, they say they rolled their ankle, it's a little bit sore. Grade 2 ankle involves a little bit more significant stretching of these ligaments, where again, it's maybe difficult to walk. It'll be much more swollen and bruised. But when I do what we say an anterior drawer test, is when I yank this ankle forward like this, it's stable. Finally, grade 3 ankle sprains are my patients that come in, they're on crutches, their ankle looks terrible. It's this big around, especially on that outside. It looks like a grapefruit, and they're in significant amount of pain, and it's bruised. And in those cases, there is complete rupture of these ligaments on the outside of the ankle. And so those are the 3 grades of ankle sprains. And so it depends what the grade is about what we do. So typically for a grade 1 ankle sprain or a minor ankle sprain, what we'll do is I will allow my patients to get in an ankle brace, which they can wear in a tennis shoe, and they can walk and they can actually do what they can tolerate. I'll give them some exercises to work on, some anti-inflammatories, have them ice and elevate it. And usually these type of ankle sprains get better within maybe 3 to 6 weeks. For a grade 2 ankle sprain, typically these are a lot more painful, and patients can't really put weight on it, or at least easily. And even if I tried to put them in a simple ankle brace, it wouldn't work. They wouldn't be content with that. They wouldn't be able to get around easy. So in that case, usually they'll go into a walking boot for 2 weeks, 10 days to 2 weeks. By then, they're much more comfortable, and then we can transition to the ankle brace, work on some rehabilitation exercises, and that might take anywhere from 6 to 12 weeks for a full recovery. Then for the most severe ankle sprains, we treat it very similar to the grade 2, but they just tend to take longer to get over. And so we'll do the boot, the anti-inflammatories, the ice, the elevation, and then from there end up in a brace after a few weeks. Subsequently, they'll do exercises, and then I tell them, listen, it's going to take close to 3 months for you to feel like it didn't happen. I always tell my patients there's sort of 2 phases in the healing of these injuries, and one is letting the ligaments heal, and the second is the rehabilitation of the ankle, meaning making it function correctly. It has to move correctly, the muscles have to get better. And I tell patients for each day or each week of immobilization, it takes 2 weeks to get that back. And my patients that have even been in a boot for 1 or 2 weeks, you'll see that calf get skinnier and skinnier. So you can imagine it takes a little bit of time to get all that functioning well. And one important thing is I don't want my patients sort of returning to activities and injuring themselves before they've regained at least a significant part of that the motion and the strength and the stability. So some of the most common questions I get are, well, do I need an MRI? And the quick answer is no, you don't need an MRI. Typically through a physical exam, I can get a good idea what's happening, and we will get an x-ray to make sure that there's no fractures or chips of bone or other abnormalities, but we don't need an MRI as they don't help with the diagnosis necessarily or the recuperation of this type of injury. But with a caveat, meaning if a patient isn't progressing like I would expect them to progress over, say, 6 to 12 weeks, and they say, no, doc, this spot continues to hurt significantly, not just like it's sore or it's a little bit of swelling, not that necessarily, but significant pain at about 6 to 12 weeks, somewhere around there, then I would consider getting an MRI. But I'll tell you, I've been doing this a very long time, and it's seldom that occurs. Maybe 1 in 50 patients, something like that, might need an MRI. So it's uncommon. The chances of a great recovery are excellent, and really no further problems related to the injury. I think the correct treatment is important, because I see a lot of patients that have come to me either having been seen in urgent care setting or otherwise, and they sort of just assumed, oh, it's just ankle sprain, I'll just walk it off. We've all heard that, right? We've all heard the ankle sprain just walking off. Well, that's untrue. These are torn ligaments. They need the correct treatment. Yes, they rarely need surgery, but they need the correct treatment for the best outcome. So another common question I get is, these are torn ligaments, don't they need surgery? And the answer is no, they don't need surgery. Even the most severe of ankle sprains, grade 3 ankle sprains, complete rupture of the outside ligaments of the ankle, they do not need surgery. Only in very seldom cases do ankle sprains require surgery. There are a couple conditions that can occur in patients with ankle sprains, which would lead to persistent pain over, say, 8 to 12 weeks. Typically, I tell patients it'll get better, get a little better every week. And then when you get out of the boot and you start doing more, it'll get aggravated. And even when you're in a brace and you start increasing your activities, it'll get aggravated, it's gonna get swollen, but it overall gets better. There's sort of 2 conditions that can occur with ankle sprains that can lead to persistent pain. In my experience, these are the 2 most common and that I see most frequently that end up needing more intervention, mainly surgery. And so one of the 2 things that can occur is when these ligaments tear here on the outside of the ankle, they don't necessarily heal with perfect ligament. It's sort of part scar tissue, part ligament. And so what can happen is if these tissues here become overgrown, you can develop what we call ankle impingement, meaning that scarring of those ligaments and even inflammatory tissue, when your ankle goes back and forth, if it's scarred or thickened in this region, or if there's persistent inflammatory tissue, it can pinch on that side of the ankle, which can be a persistent source of pain. And so in that case, what we do is we arthroscopically or minimally invasively put a camera on the ankle. We can look around the ankle, and we have small instruments less than the size of a pencil that we can sort of go in there and remove that tissue. And if you go to my YouTube channel, Dr.Desai, you'll be able to see a few videos of me performing arthroscopy to remove that inflamed tissue. The other condition that can happen that can cause persistent pain is what we call a osteochondral injury. So basically what happens is when your ankle turns, the cartilage of this talus bone can get damaged. And when that occurs, we call it an osteochondral lesion. The problem is these don't do a really good job of healing themselves. They tend to have a poor blood supply. And so in that case, what can happen is that little divot of cartilage and bone can continue to cause pain. And in those instances, those often require surgery to go in there and clean that diseased or dead piece of cartilage and bone out and perform what we call a microfracture, which there's probably for another talk, but there are other treatments for that to kind of improve that tissue that is in that divot. Probably the most common question I get, and a lot because I see a lot of the kids that have been injured in sports and athletes, is, well, when can I go back to sports? When can I start playing? And listen, I don't blame people. I'm the same way. I want to get back to doing things, and you know, I'm 43 years old now. I've had 2 shoulder surgeries, luckily that are doing excellent, but that was a lot of my concern too. When can I go back to work? When can I get back to lifting weights and doing sports? So my rule of thumb is usually when you're in an ankle brace, so you make that transition from the boot to the brace, I say, okay, well, you can start increasing your activity as tolerated. It's not a no pain, no gain thing, but you can start at least doing some low impact activity, meaning like a bicycle or an elliptical, and see how it goes. If that feels okay, then you can graduate to like walking on a treadmill. And if that goes okay, you can start initiating high impact. But I always tell my patients, be patient. It's gonna take a little bit. Feet and ankles just take a long time to get over. The swelling goes downhill with gravity. So my patients often ask, well, how long is the swelling gonna be there, doc? It's been 3 weeks and they're still swelling. Well, I say, listen, the swelling can last several months. And after surgery, I tell patients it can last up to a year. Swelling goes downhill with gravity. And the other thing is your feet just don't get a rest. We all have to walk. It's not like a hand that you can sort of avoid using if you have to. So between those two things, it will take a little bit of time. But typically, once you're in a brace, I say increase your activity as tolerated, and it will slowly continue to get better. I hope this has been educational for you. My website is footandankledfw.com. And there's a lot of cool links. There's surgical videos and informational stuff on the website. You will also find under the patient resources, you'll find some ankle exercises, which I will typically direct patients to after having these type of injuries. And then my Instagram is Dr. Desai, and my YouTube channel is Dr. Desai. We'll also post this video, and if you have questions, I'll try to answer them the best I can. Obviously, this is not a substitute for getting medical treatment. So if this occurs to you, certainly go to your doc and have them check it out, and they'll get you the correct treatment, hopefully. And take care, and God bless.